tests. They don't work like natural D does for whatever reason.
Really?
Yeah, they don't work at all.
What do you mean?
So everyone thought, like back in like the 80s, 90s, scientists started noticing that people who naturally had lower amounts of vitamin D in their blood had higher rates of all like the classic chronic diseases. So they started thinking, okay, vitamin D, it's like a magic pill almost. It'll reduce everyone's risk of all these diseases if we raise their rates of D. So they started recommending vitamin D pills, which I think are still like the #1 supplement in the world.
I take it.
So then they did all these clinical trials to prove that it would help. Huge clinical trials, tens of thousands of people, follow-ups that went for many years. None of them showed a benefit.
No benefit in terms of your immune response?
No benefit for any condition.
Now, did they take vitamin D along with vitamin K2 and with magnesium? Because that's what's recommended.
So I mean, there were a bunch of different...
For decades, we've been told that if we're low on vitamin D, we can just pop a supplement pill. But the history of vitamin D shows that our bodies were never designed to absorb it in isolation. In the late 1800s, when rickets plagued Scotland, researchers fell into a dietary trap. Here is the bizarre dog experiment that started it all.
Everyone in Scotland ate at the time. And the dogs got rickets. And he thought it was the oatmeal. He's like, okay, so something about diet. But then he got lucky because he had deprived the dogs of sunlight. And that's why they got rickets. So then eventually they realized that light hitting cholesterol molecules in the skin actually converts the molecules to vitamin D. So vitamin D is like downstream of cholesterol, but it takes that same ultraviolet light that can screw up your DNA. It actually breaks a bond in the cholesterol molecule, which it gives it some movement, and it flips around into a new form that's vitamin D.
It wasn't diet, it was the sun. When scientists finally looked closer, they discovered that vitamin D isn't just a nutrient, it's a hormone synthesized by a highly specific solar reaction. Here is the molecular physics of how sunlight actually converts cholesterol in your skin.
So once they figured that out, then they're like, sun's really good for you. So we had this era in like the 20s, 30s, and into the 40s when everyone thought sun would cure everything. And they like went after it hard.
Really?
Yeah, like parents would send their kids up into the Alps in like the 20s to institutes for heliotherapy. Kids would ski around in their underwear, take classes in their underwear. There's awesome photos from this era. Like the instructors are in their underwear in the mountains outside in Switzerland, teaching the kids, and everyone looks really healthy, right? So there's kind of like this idea that you couldn't get too much light. So people were...
Yet, despite this elegant evolutionary design, the medical establishment is terrified of the sun. When Rowan Jacobsen published The Science Behind Sun Exposure Benefits, he was met with immediate regulatory pushback. Here is how the American Academy of Dermatology responds to the research.
Then you're in trouble. Like, that's the kind of thing that triggers trouble.
Was there any pushback on this research? Like when you first started examining this and realizing that sun exposure has a lot of benefits, were any dermatologists saying, hey, this is dangerous information, you shouldn't say this?
Hell yeah. I've been denounced multiple times by the American Academy of Dermatology, like officially. They send an official letter when I write an article, and they say, nobody should be getting any sun exposure.
That's their opinion? No one should be getting any sun exposure, regardless of the benefits, the vitamin D,
No sun exposure without protection from either sunscreen or, clothing.
Wow.
And if that makes you vitamin D deficient, take a pill. So that's what needs to change, because those pills haven't panned out.
If medical dogma orders you to block out the very light that drives your endocrine system, you aren't practicing healthcare, you're practicing solar avoidance. And that's the part they don't put in the headline.